on that. Another challenge is to extend the lumen of the organ, we have to use a medium to extend the bowel. In normal endoscopy, air is inflated. A capsule cannot carry air to inflate the bowel. So what we do is we have the patient drink liquid before the procedure so that the bowel and the digestive tract is under liquid. And this enables us to have the lumen nicely distended to visualize. And now if we are going underwater, we can also look into some nautic technologies for moving inside. And this is an example of where we use the fish-like movement in the stomach, just to demonstrate this in a quick video. So this is an external, like a fish, yeah? It's a capsule that has a fish fin on the back, and this is by an external magnetic field, not internal, just an external magnetic field caused to swim. So this shows that biomimetic strategies can really help, and although this might not be our latest or last prototype on the way, it is something that we can at least demonstrate works with magnetic forces. Now, the other things we are evaluating, again, are legs. This is very thrilling, and Arianna Menchasi and their team in Pisa are doing a fabulous job, but this is technically extremely challenging because there are several electrical motors inside this small capsule to move those legs. We are also thinking about submarines as we are using water for distension, and also vibratory locomotion to have the capsule vibrate and using this vibration to actuate locomotion. Now, just a quick movie of one of the earlier prototypes of this walking robots that have been developed in Pisa. You can see it here, it's still wired, but you can see the legs, nitinol legs with the electromotors here, and this is in this open model demonstrating its capability to move along the digestive, or part of the digestive tract at least in this model. Again, there's still a lot more work to do on this side. Vibration is another nice example. I can show you a quick video here. So this is, the capsule is pretty much stuck here in a bowel fold, and we are now using the vibration to shake it out of this bowel fold, which works pretty well, and through this it gets into a new position where it can be again guided around this fold and flip over this fold, and through this, this is a flexure, one of the steep curves of the bowel. So you can now see it's moving out of this fold step by step, and then getting into the next segment of the lumen for further propulsion. Now we have made the curve. Now, the locomotion side is among the most challenging. Diagnostic, we're working, as I said, on ultrasound. We're working on enhanced optical diagnosis. Another thing we're developing, and this goes a little bit outside of the capsule, is non-visual sensors, so not optical capsules, but sensors that can be swallowed for the detection of bleeding, because bleeding is an important emergency in the digestive tract. This is a capsule that can either be implanted with endoscopy or that can just be swallowed. It's a bleeding sensor, a telemetric unit, and this is how it looks. So this is this sensor. It has optical components, LEDs, and photodiodes, and electronics, batteries, and a telemetry antenna. That's the size here. And this implant can be just swallowed by the patient, and the measurement principle is that we use two wavelengths, red and blue, and if blood is in this measurement gap, the sensor will send out a signal. And we have tested that in animal labs already. So this is this prototype of this sensor, which is exposed to blood, exposed to other liquids, and what we can show is that it's very specific for blood. So no other things like red wine or other liquids that are occasionally in the stomach would interfere with the signal. And this is a spin-off of our vector project. So this is not a capsule for a capsule endoscope, but is a blood detection capsule that is now pursued further. At the end, therapeutic, I said capsules shall also be therapeutic devices in the future. We have been able to adapt a very special nitinol clip that is actually a clinical product already of Ovesco, the company. This clip is usually delivered to the tissue by means of such a cap that is fixed to the tip of the endoscope and is used in clinical cases for the treatment of hemorrhage or for the closure of organs. It's a very effective tool because it's a very powerful endoscopic clip, and we have been able to attach and adapt this clip to this wireless capsule. So this is actually, we've tested that in an animal just last week in Berlin. This is the first wireless clip delivery that has been made with such a device ever. And this underlines that capsules can become therapeutic devices and not only diagnostic devices in the future, and that's definitely on the agenda for us in the Vector project. So summarizing, ladies and gentlemen, I personally believe capsule endoscopy combined with robotics and other micro technologies has a great potential from my personal medical perspective, has a great potential for enhancing the early diagnosis of digestive cancers and thus reducing the incidence of this disease in the future. Thank you very much.